Hello everyone, you're watching PHYSIOCLASSROOM channel, and in this part of the Kinesio-Taping series, we are going to learn through practical demonstration how to apply kinesio-tapes for Bell's palsy patients in order to facilitate motor recovery. The important muscles that we are going to target in this demonstration are the frontalis, which is responsible for producing the upward movement of the eyebrow as in the surprising facial expression, followed by the orbicularis oculi, which is again a round shaped muscle around the eye responsible for the closure of the eyelid. The next muscle that we are going to target is the zygomaticus major and minor muscle, which are responsible for the lateral and superior movement of the angle of the mouth for the smiling expression. And the last muscle that we are going to demonstrate is for the orbicularis oris muscle, that is again responsible for the orofacial expressions and also to purse the lip. The idea of using kinesio-tapes in Bell's palsy patients is not only to improve the blood flow in the paralyzed muscles, but also to improve the cutaneous sensory inputs that will be provided by the application of the kinesio-tapes, which in turn is going to make the brain more aware of the muscles that are required to be fired or move. So let's get started with the practical demonstration of the kinesio-taping technique for Bell's palsy. To start with, the first muscle that we are going to tape is the frontalis muscle, which is responsible for the raising of the eyebrow. So here I have two pre-cut eye strips according to the measurement of the forehead of the patient. Now what the therapist needs to do is to first explain the patient that patient has to use both his or her hands to expose the hairline up and then gently place the fingers of the other hand to pull down the skin of the forehead in the downward direction. So I want you to perform the same thing. Expose your hairline up with one hand and gently pull down the skin of your forehead in the downward direction. You can go more. So after whole of the forehead is exposed and the skin of the forehead has been pulled in the downward direction, the therapist is going to first use the bigger eye strip for the center of the forehead. So after the skin over which the tape has to be applied has been pulled or stretched in the downward direction, the therapist is next going to tear the paper backing from one end to create an anchor. And after removing the paper backing, this part of the tape is going to be adhered over the superior portion of the forehead. After rubbing the tape in this manner to ensure that the glue is activated, the rest of the paper backing will be gently moved up by the therapist, ensuring that the last part of the tape still remains with the paper backing. And now, while stabilizing the superior part of the tape, the therapist is going to apply around 10% stretch to the tape and then is going to just gently put the remaining of the tape over the forehead. So this is going to be the first tape to facilitate the activity of the frontalis muscle. So the second eye strip is going to be applied just lateral to the first one and it is going to be relatively smaller. Now again, tear the paper backing from one end to create an anchor. After tearing the paper backing, remove it and then place the anchor, avoiding the hairs. Rub the anchor and then remove the rest of the paper backing, keeping little for the end. Hold it, give slight stretch and then place the rest of the tape. Rub it to ensure that the glue is activated. Now, especially for the physiotherapy students, I would like to mention here that since the skin was pulled or stretched in the downward direction, and when the tape was applied, the tension was again created in the downward direction. The recoiling of the skin as well as that of the tape is going to take in the upward direction. And therefore, this is going to facilitate or assist the movement of the frontalis muscle. Now the next muscle we are going to tape is the orbicularis oculi muscle, and for this I have pre-cut 4 small eye strips, and these are going to be used to facilitate the closure of the eye in Bell's palsy patient. So it might be little difficult to present here, but still I will try my best to explain the concept of this taping technique. So to tape the upper portion of the orbicularis oculi muscle, the patient will be asked to gently close the eyelid with one of the hands, while the fingers of the other hand is going to be placed over the eyebrow to gently lift the skin of the muscle in the upward direction. So to tape for the upper portion of the orbicularis oculi muscle, first the skin needs to be pulled in the upward direction, whereas the eyelid is going to remain gently closed with the help of the patient's fingers. And now the first tape is going to be applied from the medial corner at the junction of the eye and the nose, and with 10 to 15% of stretch, this is going to be applied towards the lateral direction. Now similarly, the second eye strip is going to be applied from the outer corner of the eye, and this is going to go towards the medial direction with 10 to 15% of the stretch. Now it is important to understand what these two small strips are going to do. Now because the stretch has been applied in lateral to medial direction for the outer eye strip and medial to lateral direction for the inner eye strip, the kinesio-tape is going to recoil in such a manner so that the resultant vector of the recoiling force is going to be produced in the downward direction, which is going to help the patient for the better closure of the eyelid. As we can also see here that the individual's left eye is opening more as compared to the right one. Now another important information to be shared with you all is that the intention here also is to keep the weaker or the paralyzed muscle in a shortened position using the kinesio tapes. And by keeping the weaker or the paralyzed muscle in a shortened position for prolonged period, what we can actually achieve is the spindles can also become shortened of these muscles, and a shortened spindle becomes more sensitive to stretch, so these muscles are going to have a better stretch reflex and therefore higher chances to get contractility or activation. Now the similar concept needs to be applied to facilitate the lower portion of the orbicularis oculi muscle, and this time while the skin of the lower part of the eye is going to be pulled or stretched in the downward direction, the therapist is going to apply the two eye strips again from the medial to lateral direction and from the lateral to medial direction. Again, the recoiling is going to take place in such a manner so that the lower eyelid is going to be pushed in the upward direction, and therefore the patient is going to have better closure of the eye. So the next muscle that we are going to facilitate or activate is the zygomaticus major and minor muscle, that is going to help the patient have better facial symmetry and improve the smiling function. So for this, the anchor of the Y strip, we have prepared a Y strip for this taping. This needs to be applied over the temporomandibular joint. So here I am going to just tear off the paper backing, and now I am going to apply this anchor over the temporomandibular joint region. And now after rubbing the anchor, I am going to take the superior tail of the Y strip and I am going to create some 15 to 20% tension, and I am going to apply it so that the tail is pointing towards the upper portion of the lip. Remember that the patient has to keep the skin stretched during the application of the kinesio tape. Now the last muscle that we are going to tape for the Bell's palsy is the orbicularis oris muscle. Now to activate this muscle, the therapist again is going to use two eye strips, one for the upper portion and one for the lower portion. And this time the application is going to be the center first application. That is, the tape has to be torn from the center portion. Now to stretch the skin around the lip region, the patient is going to be asked to open the mouth as wide as possible. Now after the patient has opened the mouth, remove the paper backing towards both the ends, apply tension around 15 to 20% and then apply the tape with no tension at the ends. Similarly, for the lower part, patient mouth is again going to remain open. Tear it from the center, remove the paper backing to both ends and then apply with 15% stretch and then no tension at the ends. Relax. So this was all about the important information I wanted to share with you all about how to use kinesio-tape to facilitate weaker muscles and gain motor recovery. It should also be remembered that the patient should be taught how to self-remove the kinesio-tape without causing skin irritation. In our next part of the kinesio-taping series, we are going to learn the practical application of how to apply kinesio-tapes in muscle contraction headache patients. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.